are courses are not things that are created ideally for students. They are created with students. And that is an enormous shift in thinking that actually makes it's more important to think about fundamental shifts, some of which I know that you all in this particular medical school, trying to be non-traditional in good ways, have already done. So I suspect much of what I'll say at the beginning here about pedagogy will confirm or affirm things that you already believe and do. That's fine. I'm looking for the point where I make you uncomfortable, where there's a little disorientation, where I talk aspirationally about something that either in your own individual work or institutionally at Hofstra is not quite happening yet, or not quite happening as fully as it might. That's when the learning can happen, not when you just nod and say, yeah, already doing that. So it's not just about adding new techniques, it's about a fundamental shift from seeing yourself as an expert on the content and say cardiology or epidemiology or whatever, to seeing yourself as an expert in teaching that topic. I mean, I work at not only K-12 education, but also with university educators all the time. And in the college environment, I'm struck again and again by how some of the most eminent historians and philosophers and chemists and physicians really don't know much about how to help students understand history or philosophy or chemistry or medicine. To put it differently, the goal is to see yourself not as a teacher of medicine, but a teacher of students who happen to be students of medicine. And that's a huge shift. And it's a challenging one because academics are trained and honored and tenured, usually mostly on the basis of the content they know, not on the basis of their expertise in pedagogy, which many higher ed instructors frankly don't have much of. In universities, it is fairly typical to find that people see the teaching part as something they have to do, almost like an occupational hazard. That's why you find professors who talk about research opportunities, but teaching loads. You know, the teaching isn't necessarily something they're good at or know how to do well or have been helped to do well, but they have to do some of it anyway. The other shift in terms of pedagogy is between covering a curriculum and helping students to engage in discovering ideas. Whenever we talk about covering a curriculum, we are implicitly assuming that there's a bunch of facts, as I like to say, or of skills where the students are like wide open bird beaks and we're dropping bits of information into them. That's very different from helping students to understand ideas from the inside out and to construct meaning actively. There's a lot of educational jargon I always try to avoid in my presentations, even with teachers, let alone with parents and other constituents. But the one term everyone involved in education needs to know is constructivism or constructivist, which is not, strictly speaking, a prescription for how to teach. It is a description of how human beings learn. Certain prescriptions arguably follow from that. And the description is based on what we know in cognitive science, which is that human beings are not empty vessels into which information is to which it's transmitted. Rather, from our earliest days, we are constructing theories about how the world works. And sometimes a theory clashes with what we see, or sometimes a theory clashes with another theory that we have, and the two turn out to be incompatible, or sometimes my theory about how something works clashes with your theory. and I have to go back and revisit, reconstruct, reconstrue, reconfigure my beliefs. That's the kind of meaningful learning that skilled teachers of any age and any topic are facilitating. Although the word facilitate is itself a little problematic. People who are somewhat enlightened like to talk about the need to be facilitators of learning instead of just the people who stand there and talk and offer information. But facilitate comes from the Latin facile, meaning to make easy. And what really skillful educators do is often to artfully complicate so that students are forced to reconsider what they already thought, and knowing just when to complicate that. So once you understand that people come in already with assumptions about the human body or human life or any topic, and it's a matter of helping them to make new meaning and rethink what they thought, that leads to a different set of practices than if you assume that your job is to give them a brick of information about medicine, followed by another brick, followed by another brick, followed by another brick, and then assume at the end they have a house. They don't. They have a pile of bricks, and typically they don't have it for very long, because if it's not used and it's not experienced as meaningful, it is quickly forgotten. Even the more popular educators in higher education, I find, are still doing the transmission model. They're just doing it more entertainingly. And even people who are interested in working for social change and think of themselves as radicals are often quite reactionary in their pedagogy. But that's a different topic. So even with respect to our emphasis on knowledge, to the extent that that does matter, that there is some emphasis on covering some things everybody needs to know that we believe are essential, transmission in the typical sense of lecturing tends not to be very effective. There's decades of research on that the research shows that lecturing typically doesn't work very well, even for retention of information, let alone for a more ambitious goal like understanding, that a variety of active learning strategies make a lot more sense. There was a writer many years ago named George Leonard, mostly forgotten by now, who said that lecturing, I'm paraphrasing here because I don't have it in front of me, lecturing is the most effective strategy we have for getting information from the instructor's notebook to the student's notebook without touching the student's mind. I think of that every time I'm tempted to lecture. Even people who are a lot less radical than I am, who've looked at the implications of lecturing, say, phase it out, no more than 20 minutes or so at a time, particularly when it's not a one-shot deal like this event is, but in a part of a class. Notice that I said that one way that ideas are helpfully challenged and reconstructed is when my ideas clash with yours. How would I know that's true if we're all just sitting in an auditorium listening? Auditoriums are not meant for learning, they're meant for listening and for performances. And if you're doing a performance, you're not an educator, you're a talker. Cooperative learning, where students spend most of the time in pairs or small groups, is what allows that kind of interesting challenge to happen, not only because we can divide a task up in a way that's more efficient, but because we can challenge each other, hopefully in a caring fashion, to say, really? You thought the patient's symptoms added up to this? Because I didn't see that at all. And now we both have to, now some learning can happen in a way that's less likely to happen if you just read it in a book or hear it. Projects, of course, are a key component of learning where they're actually doing it. I don't have to tell you folks about project or problem-based education. Last May, I went back to the mothership on that. I was speaking at McMaster University in Hamilton, Ontario, which basically invented problem-based medical education in the late 60s, although I was mostly talking to instructors in other fields, not mostly in their medical school, but still now I have bragging rights that I saw it up close. Projects are not just an add-on, they're typically where the real learning happens, not what happens after the learning. Ultimately, courses are in any field, and by the way, I think this goes for children learning as well. The best classes are organized around problems and projects and questions. Ideally, the student's own questions, not a list of questions prepared for them, as opposed to organizing a class around a list of facts or skills. The best kind of pedagogy happens when the watchword is, as one friend of mine likes to say here, talking to fellow faculty members, less us, more them, where we do a lot less telling and a lot more asking. And that means, in very practical terms, having students summarize the discussions instead of having us summarize them. Or if we're going to begin with a review of where we were last time, why tell them yourself when you can ask them and have them do it? Have the students predict experimental results and evaluate them, propose the hypotheses. Anytime you're inclined to just tell them this stuff and say, how can I do more eliciting from the students? Because that's more likely to lead to powerful learning. One corollary of everything I've just said about pedagogy is the least effective way of figuring out how effective these last few weeks or months have been is to give a test. We have research for years showing that the most effective teachers almost never give exams for two reasons. One is because exams measure what matter least. Typically, how many facts have been crammed into short-term memory rather than deep understanding. To tap deep understanding, you have to be doing more authentic forms of assessment to see not only what students know, but what they can do with what they know. And also to define what they know as much more than having memorized how many names of the bones in the hand or whatever the hell we're talking about here, and instead be looking at knowledge in a much richer sense of understanding connections and distinctions. The other reason that the greatest teachers almost never give tests is because they don't need them, because the classroom has been set up in such a way that students are actively talking and engaged in projects that the instructor can watch. So while they're learning, the instructor is learning about their learning and where there are holes, where there are gaps, what needs to be filled in. So there would never come a time where they have to draw a line under it, say, stop, the learning stops, take everything off your desk. Now we're going to have an exam, so I see how you're doing. When you have a medical school or a high school class or whatever that is fundamentally problem-based, project-based, question-based, student-centered, and so on, and the focus is on understanding, it makes no sense to stop that great kind of practice and then use a traditional, outmoded form of assessment like tests. There's a mismatch there. Rich pedagogy deserves authentic assessment. It makes no sense to do rich problem-based learning and then give a test. It just doesn't compute. And similarly, to anticipate what I'm about to move on to, why would you get rid of a defective method of reporting achievement, which is what I'm going to urge you to do with like grades, and continue using a defective method of assessing achievement like tests? You would want to, assessment is basically a two-step dance. You gather information about how well the students are understanding and doing, although actually assessment is often as much about assessing how well we've done as instructors that we find it convenient to pretend that's not the case and we're only assessing the students. But the step one is to gather that, and then step two is to report it back to the students. And my argument is that you never need tests for step one, and you never need grades for step two. One more corollary of this before I move on to the grades part of this is to give students a lot more say about what they're doing. Most courses at the university level and above consist of saying, read what I tell you, listen to me lecture, memorize stuff for the tests, regurgitate my ideas on command, and then I'll reward you with a good mark, at which point you could pretend I really taught and I can pretend you really learned. But the logical conclusion of less us, more them is to create courses with students. The great philosopher John Dewey said that the center of gravity in most classrooms is not in the student. It's everywhere outside of the student. It's in the curriculum. It's in the instructor. It's in the institution. But the greatest classrooms, the center of gravity is in the student. And so one of my challenges to you in your curriculum renewal process is that really true in Hofstra Medical School? Is the center of gravity really with the students, or is that true only in a superficial sense? It is scary but unbelievably exciting to discard the traditional model. The barriers are not hard to think up. A lot of us have difficulty giving up control, although we don't always acknowledge that's what's standing in the way. We rationalize our resistance with various other excuses. Another barrier is we don't have enough experience as teachers or even as former students with what it means to create a more democratic, student-centered classroom. We may lack the expertise at how to do that. You don't know just by hearing somebody like me talk for a while what it means to create a classroom like that. You have to really have a fair amount of experience at that. Another barrier is institutional pressures. And then sometimes, ironically, there's another barrier is resistance from the students themselves. I don't know if any of you have ever experienced that, where you try to create a classroom where the students have to take responsibility for helping to plan the curriculum and the assessment and figure out what's going to happen next, and the students push back. Isn't that your job? You know, it's a hell of a lot easier with what I'm used to before I got here, where the teacher made all the decisions. All I had to do is lie back, take notes, cram it in my head, spit it out again for a test, and move on. There's lots of kinds of resistance, which means you need to get support and solicit ideas from instructors who may be a little farther ahead on that journey than you are. Another great thing to do, if what I'm saying resonates with you, but scares you, is to take a class in a field that's not your own, to remember what classrooms and learning is like from the student's point of view, in case that memory's gotten hazy. And also phase it in gradually with small issues. Start by letting students decide on the due date for an assignment. Then let the students decide on the number of assignments. Then let them choose the assignments from your list. Then let them create the assignments together and generate them, and so on. But now let me move from that to assessment itself, to the second step of that two-step dance. Once we've gathered the information about how well we think the students and we ourselves are doing, how do we report that back? So the simplest critique of using grades in a medical school is simply the fact that they're not very reliable. They just don't provide information because the criteria vary so much from one medical school or even one instructor to the next. Michael Ryan at the Virginia Commonwealth University and his colleagues, in an article published just last year in Academic Medicine, writes, and has links to citations for each of these sentences, there is no evidence that grades possess a consistent and uniform value across, or in many cases within, institutions. The definition of honors or pass is dependent upon the local grading structure. And yet the residency program directors apparently are assuming a uniformity that doesn't exist. So again, a kind of mismatch there. They go on to point out that demographic variables and situational variables, like where they did their clerkship, explain more of the variation, in statistically speaking, in the evaluation students get than the performance. If demographics and situations explain which students get better grades, you have got to stop grading because it's a lie, basically. But I'm not going to say anything more about those sort of that low-hanging fruit in terms of the reasons for getting rid of grades, namely their lack of validity and reliability. I want to offer much more serious reasons to oppose grades. Even if they were reliable and what I just said wasn't true, you should still never give grades. And by the way, also related to that are equity concerns about the kind of background students have, the social and economic and race-related pressures that they have faced in their lives. Trying to introduce considerations of diversity and equity also argues against getting rid against grades. But again, not by any means the only reason to do that. And even if we were able to address those to grade more fairly, we should still not give grades. Here's why. Research in general suggests that there's a difference between doing things to people and working with people. There are two ways that we try to do things to people. One is punishment. Do this, or here's how I'm going to make you suffer. And the other is rewards. Do this, and you'll get that. Punishments and rewards are not opposites. They are two sides of the same coin. And punishments and rewards can only buy you one thing, ever: temporary compliance at an enormous cost. If I was in the room with you right now and I threatened plausibly, credibly, to hit you with a baseball bat unless you sat down if you were standing, or stood up if you were sitting, you would probably do it. If I offered you $1,000 to stand up or sit down, again, would you do it? If you wouldn't, you are either awfully defiant or grossly overpaid. I think you would probably do it. Punishments and rewards can work to get one thing, but they can never get anything beyond temporary compliance. And they often make things worse, meaning they are not merely ineffective, they are counterproductive. This is true of all punishments and rewards, whether we're talking about parents controlling children, teachers controlling students, or managers controlling employees, or any other scenario you care to come up with. It's the same basic, outdated form of psychology derived from the work of a guy named Boris Frederick Skinner. You know what I'm talking about, even if you didn't know his actual names. B.F. Skinner, man who did most of his research with rodents and pigeons, and then wrote most of his books about people, that B.F. Skinner. All of this comes from, and I've been studying rewards and punishments for, good God, a long time now, many decades. And the one lesson from this research and from this thinking that continues to crystallize and become underscored for me is that all punishments and rewards, yes, rewards too, are really about power. They are always about control. It's just in the case of rewards, it's sugar-coated control. But rewards are always offered by people who have more power to people who have less, to make them do what the people with power want. I think you see where I'm going with this, but in case you think this is a tangent, let me tip my hand by saying grading is fundamentally a behaviorist exercise that, even if not intended, is invariably experienced by the students as a form of control. as reward and punishment simultaneously, depending on which grade they end up getting. Now, if I took 100 people and gave them all a task to do, like a puzzle to solve, and I split them, randomly assigned them to two groups. The first group was told, here, see if you can figure out this puzzle. And the second group was told, see if you can figure out this puzzle, and here's the reward you'll get if you succeed. The research demonstrates that people in the first group are far more likely to be effective at puzzle solving than those in the second. In other words, people doing something to get a reward invariably do it less effectively than people who are not promised a reward at all. And that is more true if the task involves creativity, ingenuity, or higher order thinking. This is contrary to the common assumption that rewards motivate people to do their best. Do rewards motivate people? Yes, they motivate people to get rewards. And that's typically at the expense of excellence at whatever they had to do to get the reward. Now, there are multiple reasons why rewards, just like punishments, tend to undermine excellence. The one I want to focus on now is rewards undermine excellence because rewards undermine interest. More than 100 studies across cultures, genders, and ages have found that the more you reward people for doing something, the more they tend to lose interest in whatever they had to do to get the reward. So, for example, children who are frequently rewarded or praised, because praise, good job, is just a verbal doggy biscuit to control their behavior. It functions almost exactly the same way as a symbolic reward, like a grade, or a tangible reward, like a dollar, or a toy, or candy. So when we reward people, when kids are rewarded, they turn out to be less generous and caring than their peers. And the effect is most pronounced if they're rewarded for being generous. If we say to a child, oh, good job, I like the way you shared your muffin with Diane. You're such a generous person. He just became a little more selfish as a result of that. If this were an in-person workshop, I would stop here, ask you to turn to somebody sitting next to you and try to figure out why. Why does giving positive reinforcement for, in this case, generosity, tend to make people less likely to act that way in the future? And if you are curious about this, or at least what I think, or what other researchers think, we can talk about it. But it's true, regardless of whether we have managed to make sense of it. And it's not just true for generosity. If you want to destroy kids' interest in reading books, you give them a prize for reading a book. Now, they don't want to read again unless there's a prize. It's true for adults. People who are trying to lose weight, exercise more, quit smoking, if you give them a financial incentive, they actually do worse than the control group. In other words, the reward is not just ineffective, it's actually counterproductive. And this is true with respect to the quality of the work people do too. The more they see themselves as doing it to get a reward, the more the quality and interest tend to decline. Now let me talk about grades in particular. I'm pretty sure I've read every study that's ever been conducted that involves comparing a grade group to a non-grade group at any age level. I'm not boasting, there aren't that many. Sadly, too many of the studies on grades compare one kind of grading to another kind, because the premise is, of course, you got to give some kind of grade. Let's just tweak it a little bit. But when you actually give people either grades or no grades at all, you tend to find three robust effects in the literature. The first effect is that students who are doing something to get the grade become less interested in whatever they were asked to learn about, whether that's nephrology or poetry or anything else. They become less interested in learning itself. You take students lucky enough to go to a school where there are no grades at all, all else being equal, they're going to be a lot more excited about what they're learning than even the most motivated student seems to be who's not given grades. Second, students given grades tend to pick the easiest possible task if they're given a choice. Not because they're lazy, not because they lack a growth mindset, which is a phrase that conservatives love because it situates the problem inside the kid's head as an orientation or mindset they have to learn, rather than seeing the structural causes of this, like the use of grades in the institution. It's not because they're lazy, it's because they're rational. Duh, if the point in here is to get a 100 or an A or a 10 or whatever, of course I'm going to choose the easiest task because that maximizes the probability of my getting the reward. And the third effect, according to the research, is that students given grades tend to think in more superficial ways, more shallowly than students who are lucky enough to be in a place where there are no grades, which I don't have to tell you becomes even more critical as they move ahead into, in your case, the clerkship portion here. Let me make this clear. It is possible for students to be very motivated to get good grades. But the question we need to ask is not how motivated are the students? The question is, how are the students motivated? Psychologists distinguish between intrinsic and extrinsic motivation. You familiar with that term? You heard this before? I find even teachers who know what those words mean seem to forget the relevance and go back to talking about how do I motivate my students. So if you need a refresher course, intrinsic motivation means that you find what you're doing valuable, meaningful in its own right. Extrinsic motivation means you do something in order that something outside of, extrinsic to the task will happen, like you get a good grade or some other reward. It's not just that intrinsic and extrinsic are different. It's not even just that intrinsic is better and more powerful, though it is. It's that intrinsic motivation tends to evaporate in the face of extrinsic motivators, which is just a different way of saying what I said a few minutes ago. The more you reward people for doing something, the more they lose interest in whatever they had to do to get the reward. That is a bad thing in its own right, because we want students to want to do medical care and to find and solve these puzzles and to help people. But it is also bad because intrinsic motivation is the engine of excellence. And so when we grade them, for example, in their clerkship years, the research predicts that they will become somewhat less intrinsically motivated as a result of those extrinsic inducements, which will, to some extent, with most, maybe not all, but most of the students, cause both their excitement about what they're doing to attenuate and undermine the quality. So it's not just that the grades are inconsistent or unreliable, it's that grades are powerful enemies of learning. All grades, the ones who get the high grades and the ones who get the low grades as well. Now, this research has been replicated in many, many different ways. And the alternatives, which I now want to spell out very briefly, and then in a few minutes turn to your questions and responses, can happen in the short run and in the long run simultaneously. Whenever something happens in institutions that's not ideal, I think we need to do just that. We need to, in the short run, before the institution changes the structure, do what we can to minimize the damage of the status quo, and simultaneously organize and mobilize to change the process. So if you are teaching students and you are still required to give them a grade at the end, you should make grades as invisible as possible to them for as long as possible. Never grade them on an individual task or assignment, even if you have to give them a grade at the end. Because every time you give them a number or letter, a rating of some kind, you become part of the problem and can no longer just blame the institution. As soon as the student comes to be thinking about what am I going to get at this task, in this rotation, in this clerkship, in this class, damage begins to happen in terms of the learning process. The other thing you can do in the short run, if you possibly can offer a course pass-fail, do it. I'm amazed at how many instructors have never even asked. And then at the end of the term, when you have to give them a grade, have a meeting, have a conference, and let students pick their own grades. The reaction among many instructors to that suggestion is always interesting, because it proves that when people react with some degree of terror or horror, it sort of gives away the game. This was never about a necessary way of summarizing performance. It was always about who has the power. And this is a way of divesting yourself of the power, some of the power, in order to promote real learning and intrinsic motivation. But anything you do within an individual classroom or clerkship is just a stopgap measure. And we have to move forward in structural ways, ideally with the whole institution. First, eliminate anything that creates artificial scarcity. A reward is bad, an award is worse. You see the difference? An award is a reward that has been made artificially scarce. So if I get one, you probably can't. Now we've added the arsenic of competition to the strychnine of extrinsic motivation. We have doubled the damage. That happens. Ratings are bad enough. Rankings are immoral. Rankings don't even give you useful information about how well students, how much they've learned. It's only relative to other people. And you don't know, maybe all of them did great, so that even the one at the bottom did great. Or maybe they all did terrible, so the one at the top isn't that exciting either. You know nothing from that. Rankings are not about excellence. They're only about victory. And everybody loses from that, even the people who get the number one status, because competition and other extrinsic motivators undermine excellence, preference for challenge, and intrinsic motivation. Grades, whenever they exist, raise the possibility of competition, which will make things even worse, even if it's not explicit. Like, a lot of instructors don't explicitly grade on a curve, so the grades fall into a normal distribution, which is a sign of that your class failed, if that's true, by the way, because you should want everybody to succeed. But a lot of instructors have this little bell curve in their brains, so they think that's the way the results ought to come out, with a few doing really well, a few doing really badly, and most in the middle. And that is a prejudice that needs to be ripped out by the roots. But my point here is that grades raise the possibility of competition, even if it's not explicit. But even if you got rid of all competition, you never ranked, you never graded on a curve, everybody could get 100 or an A or a pass with highest honors or whatever. You've eliminated one problem, the competition, but you're still looking at a second problem, the next layer of the onion, which is the extrinsic motivation of the rewards. Still harmful. Next things that I think some people try to do to make things a little better is add a narrative report, but narrative qualitative assessments where you write out your impression of the student must replace grades, never be used to yield a grade, and never draw upon grades in order to write that narrative. There's 2 pieces of research I know of that have found that you get none of the benefits from a narrative unless grades are eliminated. And by the way, that also goes for eliminating any kind of point system, giving students points for things. If you really want to screw up education, give them points for class participation, which now infects and warps their reasons for participating and speaking. Now it's not about learning for them, it's about impressing you. Grades infect everything they touch, and that includes conversation. If you're make the mistake of grading for that. Points are just another form of extrinsic motivation. So are rubrics, if they are numerical. In fact, they often have so many damn criteria that it compounds the damage and is even worse than a single grade. At an institutional level, getting rid of grades and moving in these directions has to be phased in. It doesn't mean going from 0 to 60 overnight. And there are different ways, you will know better than I, in clerkships for how to do that. There are a number of objections that people raise. I'll try to, let me say this. Only performance evaluations that are qualitative should be used, I believe, in clerkships. So you need to make sure their quality is highest, have more people evaluating to improve a kind of consensual validity, to wash out the biases that might occur, have training sessions for the people evaluating, which includes maybe role playing to address various biases, racial biases, gender biases, biases in favor of the most outspoken and verbal people against those who take a little more time to think about what they're doing. You really need to make sure these are good, and then you need to replace the grades with these kind of evaluations. Very quickly, objections I tend to hear, which I'll address and then get to your possible objections. One is, but evaluations, performance-based kinds of assessments are subjective. And the reality is that grades too are just as subjective. It's just that they dangerously conceal the human judgments that underlie them by giving a very specific number to them. Just because it's quantitative does not mean it's scientific or it's objective. And subjectivity is not something, we have different ideas about what constitutes quality. It's true for physicians in many respects. I think a lot of people who know more than I do about medical education might not agree on which characteristics of a doctor matter most. Is it the willingness to listen? Is it the capacity to empathize? And those two are not the same, by the way. Is it analytical ability? Is it a storehouse of medical knowledge? Is it clinical skills? Is it curiosity? We might disagree, just like we might disagree on whether that was a good movie, or a good meal at that restaurant. What numerical evaluations do is create the illusion that there is no subjective judgment going on. Let's put it up on the surface. The second thing people say is that this is utopian to get rid of grades. It's nice in theory, although I find that people who say, well, that's a nice theory, actually, they don't even tend to like the theory. What's really utopian is to assume that intellectual curiosity and growth can coexist with grades. Will ungrading clerkships just lead to more emphasis on the standardized test, the USMLE? That's a reasonable worry because, as Ryan and his colleagues pointed out, quote, standardized examination performance predicts future examination performance, not performance as a physician. So absolutely right. We don't want to put any more emphasis on an exam. The alternative is probably, as they argue, to improve departmental competency letters to replace grades. And finally, the practical thing, but they're going to need grades to get into residency. I hear the same arguments where high school teachers tell me we can't possibly turn this high school into a learning environment and stop grading because they're going to need grades to get into college. I hear it from college instructors about getting into a graduate school or professional school. And by the way, if you at Hofstra understand the damaging effects that grades do in medical school, you sure as hell shouldn't be using their undergraduate grades to decide whom to accept in a medical school. Undergraduate grades and MCATs have very little value in predicting quality as a doctor, as an old study at UC Davis found some years ago, published in JAMA, to say nothing of the fact that those grades are going to probably give you safe candidates, not necessarily those who are the most intrinsically motivated and so on. So anyway, you got to work with the residency program directors to negotiate alternatives with this. You got to emphasize that your medical students will be better prepared for residency by coming in with their intrinsic motivation intact as a result of this having been a learning experience, not a graded experience. And then finally, it's a question of basic values. I mean, ultimately, is your goal to improve the quality of future doctors? Or is it to sort students for the efficiency, for the convenience of residency programs? If those two goals diverge, you have to decide ultimately. I mean, if you see how stupid it is to grade students in their classroom years in the first 2 years, surely you have to see that it's even more insane to assign grades for when they're actually learning to be a doctor in their clerkships. I mean, it's like, now that's even stupider than the reverse, apart from the inherent problems with grades. The question you need to ask is, how much curiosity and excellence are you willing to kill in order to do the residency program director's admission job for them? I'll close with a quotation from Karen Hauer and Catherine Lucy at UCSF in their excellent academic medicine article published in 2019, an article I think you will be provided with a link to. It's called Core Clerkship Grading, the Illusion of Objectivity. They wrote, "The primary responsibility of medical school is not to rank students, but to ensure that every graduate is prepared with the requisite competencies. Our need to assign grades to provide residency programs with information that carries the illusion of objectivity may be at odds with our commitment to ensure that every student achieves the highest possible level of competency." I don't know as much about medical education by a long shot as you do, but everything I do know about teaching, learning, assessing, and the psychology of motivation tells me that it's not a question of how you grade, it's a question of how you stop grading, and to weigh the practical challenges of doing that against the enormous harm of the status quo if it still involves grades. Questions?
Fantastic and interesting and provocative presentation. Thank you. Judy, I'm just checking in with you. Do you have voice, or do you want to do questions, or am I doing questions?
Okay. Maybe you should. You should.
Okay, no problem.
No voice. Sorry.
All good. All good.
We'll be scoping that larynx right after this session.
And we won't be offering any rewards for a job well done on that scope. All right, so let's take a look. We have a few questions in the chat, and people can continue to put questions in the chat, or if you'd like to use the hand raise feature in Zoom, we could call on you that way as well, so that you could ask your questions directly. So the first question, how do you be ungraded in a graded world? So much of pre-med, undergraduate medical education, meaning medical school and residency, and progression through these competitive environments is focused on grades. How do you do it?
I'm hoping that question was written in before the last 20 minutes of my talk, because the last 20 minutes of my talk was my best, at least 20 minutes worth of trying to respond to that. And I would also repeat what I said about working in the short run to minimize the harm of the status quo in a given clerkship or classroom, while simultaneously organizing to make social change in the institution and in other institutions, and also collaborating with other medical schools. Because frankly, if all the medical schools agree that we've got to stop doing this, the residency programs would somehow have to adapt. In the meantime, if there aren't that many who've stopped grading, it makes it easier for them, and they can't argue it's too hard to look at more holistic, qualitative, and meaningful evaluations in the absence of grades. So yeah, the fact that it is a reward and punishment based world, it is a more than an intrinsic motivation world. You could argue that it's a competitive more than a cooperative society, not world. We're talking largely about our society. I mean, it's like saying, hey, why would we try to go for gender equity when it's a sexist world out there? I mean, the last thing you want to do is use what's out there as an excuse for reproducing the problem in your own institution. You do what you can, where you can, to start making change if you find that what's out there is unacceptable, both practically and ethically.
Yes. All right, thank you. Let's see. Okay, there's a comment from Dr. Fernari. When I taught college for 20 years, everyone had an A until they proved not appropriate. No one ever got an A plus, even if allowed. I don't know. Did you have a question, Alice? Do you have a question that you wanted to ask, or just add in comment?
You're muted.
So prior to my role in medical education, which has been 20 years, I taught college for 20 years. Unfortunately, I was at a college that had grades, so I'm agreeing with everything you're saying. I never gave exams. People were like, how can we not have a test? And so I'm a believer in what you're saying. But I just told everybody, you're in the room with an A, and I have to put something on paper, and it's up to you how you degrade that. I'm assuming one thing when you all walk in the room. And it worked out pretty well for me, minus some students who took advantage, but I'd say more yes than it worked out well, more than not.
Okay, thank you.
Thank you. All right, we have a hand raised. I think that had come in next. Alan Kell, would you like to ask your question?
Yes, hi, it's Al Kale. I had the privilege of, in the late 60s, being one of 18 selected to go to the Brown University Accelerated Medical Program, where when I was 17, I signed up for the draft. They eliminated the college deferments, and they told me, oh, you don't need to enter the draft when you're 18 because you're accepted to medical school. There were only two 6-year medical programs at the time, Northwestern, where I was from in Chicago, and our valedictorian was applying there. I said, there's no way they'll take me. So I didn't apply there. BU, I got in. Brown University, which I thought was a 2-year community college, turns out I went to. And what I found fascinating was I took pass, no pass, not pass fail. And I just blossomed and found it so fantastic. And yes, they would give us tests. They'd give us feedback, critical feedback. We could reflect upon it. We could learn. And I found that I was able to blossom there, even though everybody else I met, oh, we're number 1 or 2 in our class. I'd come from they didn't call it a magnet school in Chicago, but it turned out that's what it was.
I appreciate your corroborating that the experience can work not only as an instructor, like the last person said, but also from a student's point of view.
Yeah,
thank you for that.
And as an instructor, I can share with you
if you could just, if you have a question, as succinctly as you can, so we can make sure other people have a chance.
So my question is, even though I saw a lot of folks blossom in that setting, my concern as now on the other side as a professor of practicing physician, but voluntary faculty member, that it works when you have people very highly self-motivated. And the concern I have is, how do you then, when you don't have faculty who are trained in the concept of, which is the ACGME, current NAS system, saying, well, you need remediation, you need improvement, you need, et cetera. How do you reconcile the difference between the folks who are motivated, like I was as a student, like I am as a
Okay,
educator.
let me try and address that as quickly as I can again, so we can get some. Thank you for the question. First of all, the difference is not between being self-motivated and not self-motivated. The difference often is between being intrinsically motivated and extrinsically motivated. If we have students who come in already extrinsically motivated and dependent on the grades, the last thing we want to do is compound the problem by giving them more grades. However, there may have to be a procedure, a process by which we help them to recover, as it were, a kind of detox from the poisonous effects of extrinsic motivation. And we need to hire a faculty who is adept at looking for the signs of students. And it doesn't take a lot of expertise to see when somebody's saying, do we have to know this? Is this going to be on the test? That's your first sign that something's wrong. And indeed, sadly, there are actually instructors who feed that by telling them what's going to be on the test, what they'll need to know, what's going to count for a grade. People who say things like that are, in effect, indicating what I'm teaching you now has no intrinsic value. It's all about what you're going to need for the test or the grade. If we have students coming in who need that kind of remedial help, it's not just because they don't know enough, it's because their motivational approach has been warped by a history of extrinsic rewards and control. By the way, one thing you can do until other medical schools get get with the program and start to move in this direction as well, is to think about your admissions process, not just in terms of not looking at their grades in undergraduate, but specifically trying to look for the extent to which these seem to be genuinely intrinsically motivated students, to reduce the probability that you have a lot of the students who are too extrinsically motivated. Just like I would hire for that if I were hiring people to be part of this process. It's not just how much you know, it's not just about skills, it's about motivational orientation. I've seen some questions flip by quickly. I don't know if
in the chat. Yeah,
Yeah.
so there are two questions right now in the chat related to board certification.
Okay.
So your thoughts on high stakes and costly tests for physician board cert and recertification, knowing that these exams are related to mortality, metrics, hospitalization, things like that.
Well, the question of measuring hospital care is its own interesting issue, where they should never be ranked against each other, where numerical ratings are problematic. Incentive plans, as you can guess, work, and I have loads of evidence that I've collected on how any kind of physician compensation that's based on some kind of metric of quality tends to undermine quality. But unfortunately, economists are running the show, and all economists know is behaviorism. Psychologists have moved past this rusty Skinnerian approach, but economics, neoclassical economics, only says, how do we get the incentives right? I'm allergic to the term high stakes for tests and assessments when I talk to K-12 and to some extent even university people. But I acknowledge that high stakes may be appropriate because there needs to be some kind of gatekeeper status, where we want to make sure that somebody is qualified to be a physician and to be a cardiologist or a pediatrician or a psychiatrist and so on. At the end, we would never have something high stakes earlier than necessary. And we would never be using things we know are poor indicators of quality of understanding and desire to help and do well as part of those ultimate gatekeeper exams. So I would shift away from any pencil and paper aspect of, step 3, right? And be looking just at authentic assessments that are performance-based, which I know is part of it, but in my judgment, again, not as a medical professional, should be all of it. Because a lot of people who can memorize facts will not necessarily be good physicians. And conversely, a lot of people who have to look up facts may be terrific physicians. So a pencil and paper test fails in both directions. with false positives and false negatives. But I recognize that there needs to be some kind of high stakes. You need to pass, or the alternative is maybe you're not ready yet.
Dr. Smith, I see you're on, and I know you had some questions about that sort of gatekeeper. Did you want to ask a follow-up while we're on that topic?
So my question was pretty simple, and continuing on the theme you've just crossed, which is that both medical schools and residency programs have a moral and fiduciary responsibility to future patients, that someone does not get labeled as a physician, a surgeon, a neurosurgeon, an internal medicine doctor, if in fact they are not safe to practice that and in fact are incompetent. And it would be devastatingly horrible for any medical institution that educates people to not be willing to say, you are not competent and cannot move forward. You're not safe for patients. I will say this, one of the things to my surprise, since I was more leaning towards your philosophy, but I served on the American Board of Internal Medicine, where they had almost 40 years worth of data and showed conclusively that patient outcomes were better for students who scored at the top of that test, because Medicare has endless data on patient outcomes. And I was surprised by that. But the fact is, in fact, the statistician who did it said that if we released who is the top 10% of all the test takers in internal medicine, that would do more for your longevity than all the preventive medicine you could ever do in your life, because those doctors' patients did that much better.
It would be interesting to compare first of all, to examine what's meant by outcomes here and how carefully controlled it was for the severity of the illness going in. And I would want to look at the methodology of that. But more important, or as importantly, I'd want to compare those who did well on the exam, not to those who did less well, but to those who did well on the kind of holistic, non-exam based performance evaluation, which would be the comparison group that's far more relevant for giving us information about the usefulness of the exam. It might turn out that what I'm suggesting turns out to be even more predictive of physician quality, but we don't know if the study is just looking at the exam.
Yeah, so I was surprised that the exam predicted any of that.
Yeah.
And
I am
yet
too.
It was pretty obvious with enough patient data. When you start to look at millions of patients, you can start to see things that are probably true and not accidental.
Although, again, I'm really curious about, I don't want to put you on the spot, but I'd be really curious to know what the dependent variables were, how we're measuring that. For example, are they including patient-reported satisfaction with this physician? Are we talking about long-term sequelae with patient health beyond just this particular complaint that they came in for? Are we talking about patient compliance with what the physician recommended? I would be amazed.
All those are intermediate steps in longevity and health. They're not endpoints unto themselves.
Well, if we're looking at longevity, we need to be obviously looking at a hell of a lot of potential confounds here.
Absolutely.
Yeah. Right.
But the one thing that I've been doing this a long time. It is very hard to parse out who's the best, but it is definitely easy to find out who is incompetent. It is almost never a surprise. And if it doesn't get better, it presents a real ethical dilemma for someone who's consumed so much of that student's life, and yet they're still not competent.
Right. But before we talk about how high the stakes are and how we have this fiduciary responsibility, and we'd use that as an excuse for not challenging the status quo, let's remember that this status quo is pretty damn imperfect about letting in a lot of people who are incompetent. So remember, we're not comparing it to a perfect world. We're comparing a grade-free approach to education, which has a strong research base to it, to a manifestly problematic current system that uses grades. What else? What was the other question that you said was pending in the chat?
Oh, no, we have a few more. I brought two questions together. The next question that's in the chat, a little bit of a different question, relates to the narrative evaluations that you mentioned. And so the request is, could you talk a little bit more about this process of narrative evaluations and how you see it working best in practice?
I can only talk about narrative evaluations in a very generic sense that applies to students of all ages and in all topics. I would strongly recommend that article that was in Academic Medicine, the one in 2019 by the two UCSF professors who talk specifically about what it means in clerkships, which is not my area of expertise. But in general, the best, even better than a narrative evaluation, which is really a qualitative summary of what I've noticed that includes some description of what the instructor has noticed, purely feedback. By the way, the word feedback means information. If you're offering an evaluation, that's no longer feedback, that's a judgment. Most of what is written in a qualitative summary based on what a student does during a clerkship, I believe should be purely descriptive. It should be feedback. But it may be necessary or useful, or in some cases unavoidable, given who's writing them, to include some evaluation. And here's what I think about what I noticed with this student. But you should always, anyone who writes those should really be mindful of what's the ratio in what I'm writing that is feedback and that's judgment. And there's some research showing that evaluation tends to corrupt the potential usefulness of feedback. And it is a summary of here is what this student did, could have done, changed at over the arc, the narrative arc of the time spent here, and offers this in paragraph without any numbers or letters attached to it. Now, better than that, you know what's better than a narrative feedback is a conversation. A conference where you sit down and the evaluator, the preceptor, the person in charge, the instructor, has a discussion about with the student about what was noticed. You see why that's better than even a narrative feedback? Because there's the potential, at least, for dialogue. A qualitative narrative is still a monologue. I mean, it's a hell of a lot better than you get 100 or you get a high honors. And by the way, if you're doing something like vastly exceeds expectations, meets expectations, working towards expectations, or very high honors, blah, blah, that's might as well still be A, B, C, D, F. It's still grades, don't kid yourself. And when there are those gradations, all of the disadvantages I've been describing are there in full force. The fewer gradations, the better. So if it's basically the equivalent of okay, not okay, but God damn it, we're not ready to leave out another category, which is really okay, do that as a transitional measure until you're no longer addicted to this level of evaluation. The fewer gradations, the better. You've got it versus not yet is the ideal system when it includes information for the student about what improvement was noticed or why not yet.
Giving us a lot of new things to think about. And in terms of thinking, towards maybe moving towards measuring some of the items you had suggested, there's a question in the chat about whether or not you can suggest any tools that accurately and practically measure internal and external motivation, or if you have any resources to suggest on how to improve individual internal motivation.
First, I want to distinguish again between this is not just my being a pedant here. Internal is not the same thing as intrinsic. I have met a number of internally motivated students who have simply introjected, to use the old psychoanalytic term, or swallowed whole that kind of extrinsic motivation. You see this happening often by the time kids are in high school, where an adult no longer has to stand in front of them or behind them with a carrot and stick, because the kids are working themselves nuts. They are undermining their mental health, their relationships, their emotional futures without anybody externally having to do it to them. That's why it's not enough just to internalize motivation or talk about self-discipline. Some of these students, and you meet them certainly by the time they're in medical school, are workaholics already. They are sometimes highly motivated internally, but they are joyless, and that's a problem to be solved. Now, having said that, there are two basic ways in the research literature that intrinsic motivation tends to be gauged. One is with self-report, with questions that try to get to the extent to which doing this task or engaging in this activity meets your needs, feels worthwhile, seems to you something worth doing, or whether you're doing it as a means to an end, which is what extrinsics are all about. The second way that the research literature gauges intrinsic motivation is with some kind of behavioral measure where people in the study do a task and then are left alone for a while where they can do something else like read a magazine or persist at the task. And the extent to which they willingly choose to continue to do it when they don't have to is one rough and ready guide, although it doesn't always correlate exactly with the self-report measures. But if you are interested in trying to, if the question's motive, what's behind it is, well, if we're going to accept students into our medical school, not on the basis of their grades, but partly on the basis of their intrinsic motivation to be doctors, I don't know of any instrument that exists for that, but I'd be delighted to help you see if you could figure out how to do that. Though I think, frankly, you could probably extrapolate from the kinds of things I've been describing in order to do that. And again, the questions that students ask, like, do we have to know this? Or, yeah, but doesn't that kind of contradict what we were learning last week when you said those kind of questions, when there's obviously no grades for participation, which corrupts the measure as well as corrupting the learning, those kind of questions may be a kind of rough indicator of students who are kind of fascinated by what they do. Another word for intrinsic motivation is curiosity, which is what grades and awards reliably kill. And I would argue that curiosity is part of what makes a great doctor. So there is writing on curiosity in adults as well as in children. And it wouldn't be too hard to extract from some of those writings how one might use it to evaluate the extent to which it's present in a given individual. Somebody has a hand up?
Yes, Dr. Willie.
Hi, thanks for coming. I've read some of your work, and I have a sort of, it's kind of tangential question, so you can kill it if you want. No hard feelings. So much of the discussion that we've had, almost all the discussion has, on grades is obviously the outcome at the end of a course. So I'm wondering if you could comment on sort of my fantasy of the ideal educational environment where at the beginning of a course, you have an exercise with each student where you ask each student to write down what are their goals. You know what this course is about. What are your goals? Given where you are right now in time in terms of your learning and your skills in this domain, what do you hope to accomplish in the next X number of weeks? And then revisiting that goal throughout the course and allowing that to drive the sort of self-assessment or some kind of assessment. So I'm going to stop there and you can either kill the question or answer it or whatever.
Oh, I like that. Thank you. I like that very much. And it speaks not just to the grades that I talked about for the last, say, 2/3 of my presentation, but to the issues of pedagogy and choice, autonomy, although I didn't use that word that I spoke of in the first third. Bringing the students' goals in is very important if, first of all, the intent is not just to focus, let the individual student focus on her goals and what am I going to do with them, but to exchange that so it becomes a community looking at goals and perhaps being inspired by one another's. Two, that the goals that you ask for are part of a larger attempt for the instructor to get to know these students as people and for them to get to know each other, in which case goals would be only one of many questions I would have them ask. I would ask them at the beginning. Another one I would ask is there anything you're afraid of in this course that you're afraid might happen, that makes you anxious, that worries you? And we could come up with other things so that there's more of a sense of, hey, these are not just receptacles of information. These are people, and I want to try to understand their perspective, to really to decenter. And the third thing I would say to really expand what you've mentioned with goals is that the goals they come up with should help determine what happens in the course. If you're teaching the same curriculum, regardless of the goals you heard from them on the first day, there's a problem. That was just an exercise, an icebreaker. But if their goals, their needs, their history, their worries, their background, and their specific beliefs about this topic and curiosity about what they know more, if those can help shape your curriculum so you develop the course on the fly based on what they told you, now we're getting somewhere. So those would be off the top of my head, the 3 ways to take what I think is a good idea, asking them their goals, and make it a truly powerful and subversive educational experience.
Thank you so much. We, of course, are running short on time and have more questions than we have time for. But at this point, I think what we'd like to do is we would like to ask, first of all, thank you for a very stimulating and exciting talk. And we have a short question that we'd like all the participants to answer, if you will, please, which is, what from today's talk that you've heard and that we've discussed, do you think would be important for us to take forward and carry forward into our curriculum renewal? I think we have a woo clap to, yes, here we go, to be able to have everyone participate. So you can connect directly through that website. You can scan the QR code. Lots of different ways you could participate. Oh, thank you, Connor, for dropping the link into the chat. And this way we'll be able to see people's responses together in real time as you answer. What principle from this talk we could take forward with us into our curriculum renewal. So it looks like we have kind of a spectrum of things, most extreme being to get rid of all grades or get rid of clerkship grades or move to pass fail, thinking about the important distinctions between internal versus intrinsic motivation, the reframe as you've got this versus not yet. Oh, so many. Wow, there are a lot of really interesting ideas here. Thinking about different tools to measure different things such as intrinsic motivation. Examining our rubrics, bringing our students into this conversation. We had, I think, about 4 students or 3 students when we started the call today. Clearly, we need more. Excellent. Well, really want to thank our speaker for today for an amazing talk. I don't know if people want to unmute and clap or give a little Zoom clap. You know, if we were all here together in person, you'd be able to hear the appreciation. I think you've given us a lot to think about as we all go forward together, trying to navigate this territory. Just a reminder, and thank you to everybody here who was participating. Thank you to our events team and to our curriculum renewal planning team for getting all of this organized and together and bringing this whole event to us today. Just as a reminder, a couple of things we'll just drop quickly into the chat for additional upcoming ways to continue to participate in curriculum renewal. We have additional speakers coming throughout the next couple of weeks. We'll be talking about portfolios. We will be thinking about sort of renewal at large. Then we have a couple of other exciting things in the works. We don't have the date scheduled yet, but they are coming. We have the curious questioning teams, which many of you have heard about already, which will be the working groups that are going to start meeting in December probably, and meet monthly to think about some of the really important questions that we have all come to identify leading into and during this renewal process. And then, of course, we have our curriculum renewal website that has all of the information there for anybody to access and to share with colleagues, please. So thank you again. Thank you for a wonderful talk. Thank you to everybody for staying and participating as long as you all did. And it is 5:30, so I think we are going to wrap it up here unless I missed anything off this text. Let me check really quickly. Okay. Yes, and for those who did not get a chance to ask your questions, we'll see if it's possible for us to circle back to you. Thank you so much and have a great evening, everyone.